Hey guys, my name's Chris, and I was just going to give you an update on my shoulder surgery. So today was a 6-week post-op, excuse me, from my surgery. So the surgeon told me I had almost 3/4 of the way across my supraspinatus torn, and excuse me, he said they did a lot of work in there. I guess they cleaned up bone spurs, and they did a synovectomy, like take the fluid out. And then I had 2 partial tears on the, I think it was the interprinatus and the subsprinatus or something. So anyways, they let me take my sling off, so I don't have to wear that anymore. I can, like, he said it was okay if I touch my face, to wash my face. I could type on a keyboard. Excuse me. Aside from that, like picking up a milk jug is too much weight. So they've had me using a cane to push my arm out. Passive range of motion, bicep curls, tricep extension with no weight, squeeze my shoulder blades. And today I laid on the table, and I had a cane, between my hands, and then I took the cane up over my head. My physical therapist got my shoulder up to almost 180 degrees. I was kind of surprised. Overall, I've really had no pain. Maybe a little bit. I think it was just scar tissue pulling on, like the way things heal. But aside from that, I feel really fortunate that I've not had a lot of pain. So they told me at 4 months I'd be able to swim. So right now I'm 1.5 months since my surgery, and I'm really grateful to get the sling off. I was able to sleep on my back and on my non-operative shoulder. So the whole time I saw 2 surgeons before I had this done, and chose one over the other, obviously. But neither one of them were really pushing me into surgery. Okay. One of them didn't even really want to do it, and the other one, he said, yeah, that does look like a full tear. So when because they were reading it off the MRI. Well, when he went in there, he said the tear was much bigger than it looked like on the MRI. And they did there was like 2 things they were going to do pre-op, and they wound up doing 5. So the pain was pretty good, and or pretty good as far as like how much pain was there. It was a good amount. It wasn't every day. Sometimes I couldn't sleep at night, even on my good shoulder. And then in the weight room, I think I quit doing weights for like at least 6 months. I was just like running or swimming. And I started doing them about 1.5 months before this surgery, and it was really not bothering me that much, but I already had scheduled to have the surgery done. So I'm just giving you guys like an update on what my experience has been like. So I have had a lot of other orthopedic surgery, and some of it's been trauma, like where I just wound up in the hospital, woke up, I had plates in my arm, or woke up in the hospital, and then I have metal in my leg, my back, my elbow. I crushed my foot. So I think my pain tolerance is really high, because I have a friend that just had the same surgery, and like 2 days apart, and she said she was in a lot of pain, etc. So maybe I just have a high pain tolerance. Didn't really have to use much pain medicine after the surgery. Physical therapy has hurt, but it's hurt within an okay parameter. So I mean, it hurt, but then when they quit pulling on my arm, it was okay. It wasn't like it was still hurting, like 30 seconds to a minute after they bent it, because it's been sitting, it's just been sitting like that. for like 6 weeks. Other than that, I just walked and, I did a couple hikes because I live in Colorado. Other than that, I was really careful because I'd had other tendon surgery on my thumb on my right arm. And I know that tendons take a long time to heal. So I really want to be careful, go through all this trouble, get the surgery done. I didn't want to goof it up. So now I'm just, my next visit with the doctor is in 6 weeks. And, I'm just going to follow what they're telling me to do. I'm not going to try to push it or do more than I'm supposed to. It's nice to not have the sling on, and even though I'm free from the sling, I'm still gonna have to be careful. I'm not gonna pull a door, or another thing too is sometimes I would take my sling off towards the end of the 6 weeks, for a short period of time, lay on the couch, maybe get up, go to the bathroom, but even after showering, holding my deodorant, I dropped it, and reaction, just your reaction, my arm, because it wasn't in the sling, because I just showered, wanted to go grab it. So my recommendation to you is to keep your arm in the sling, the whole time. As soon as you get out of the shower, put the sling on. Because all it takes is one weird thing happen, and it's because it's a reflex. You're gonna go to grab it because it's what you've been doing all your life. So overall, like I said, I just wanted to share my experience. Hopefully you have a pain-less experience, and this has been going on for 2 years too. So I saw one surgeon, got a shot, not right away. I waited a year, and then that was total waste of money and time. Cortisone shot lasted 3 weeks, and I knew it wasn't going to do anything. So, I was hey, I could see it was torn. I mean, I could see it in the MRI. I got a decent brain, I like to think. And, I was it's not going to repair itself. All they're doing is masking the pain. So I'm not really sure. I guess maybe some of it too is their activity level. There's a risk in surgery. You could get an infection. There could be a mistake. The surgeon could make a mistake, cut something he's not supposed to. Nerve damage, anesthesiology. They put a nerve block. I think they put a needle on my shoulder, and then they had a 20-hour nerve block. And they went over the risk. I mean, surgery's a risk, but you're doing it because most people have no complications and you have good outcome. So, so finally I went to see the surgeon, and he wasn't pushing me. He was just if you want me to do that, he's here's what I would do. And I guess they put in two anchors, and then sewed it together, and I guess he cleaned up the rest of it. But I had a lot of, another thing too is in the front of my shoulder, right here-ish, where biceps tendon is. I had a lot of pain there, and a lot of pain in the back, and I had pain going down my, the back of my arm. So I went ahead and had the surgery. So if you guys are trying to figure out, are you gonna have surgery, not have surgery, should you not, I was in that boat. I've been through a lot of other surgery. I know recovery, you can do it. I've been through times where I couldn't do much. I had to wait, slowly get back to lifting weights and running and swimming and all that good stuff. But this is going to be a longer haul, because I've barely been doing anything, and now maybe they're going to start getting the wristband or the bands out, where I can pull the band, pull the band, and then swim at 4 months. So he told me 7 to 9 months is full recovery ish, where it's fully healed. So I think that's a big reason like these surgeons aren't pushing people into doing it, because they know they're going to be down for a long time. Excuse me. I had health insurance, and who knows what's coming in this nation. So my recommendation to you is, if you're thinking about doing it, do it. You just have to weigh your options. Like, is the pain worth it? And like, who knows what's coming in this country. But anyways, like, those are all my thoughts on recovery. Mentally, it was very challenging to have that sling, though. Essentially, you might as well not even have you can hold like a phone or something, but you're not supposed to do anything with your arm. So I was doing like extensions with my elbow just to keep my elbow from getting locked up, and then that was pretty much it. So glad to be done with that stage, and just want you to know you'll get through whatever you're going through, and just weigh your options before you pick a good surgeon. Look up my recommendations, look up stuff on health grades, reviews, because I did have a bad surgeon for a surgery like 20 years ago, and you just want to look at a couple good ones and go with it, and just trust God and trust Jesus, pray about it. It'll give you peace, hopefully. So there's a lot of incredible things they can do now. They made like 6 small holes in my shoulder, and they did all that work. So hope you guys get something from this, or if this gives you peace of mind, somebody that is just sharing their experience. That's the whole point of this video, so that if you feel like you're walking alone, and you don't really know what you're gonna do, I just want you to hear my story, so you can help make a good decision based on your surgeons, your situation, and then weigh the risks versus doing nothing and continuing. Because they tried to tell me to do band exercises and stuff, and that was not helping. Especially knowing that it was torn. And then they got in there and it was worse than they thought. So anyways, guys, that's all I got. Good luck.